Hello everyone and welcome back. Today we are studying personality disorders. I am Michelle and I will attempt to cover everything you need to know at the level of a final year medical student. Here's a basic breakdown of today's presentation. It is a little bit longer than my other videos, but YouTube apparently only lets me upload maximum of 15 minutes, so this is going to be a little bit of a crash course, a roller coaster, if you will. So buckle up and let's get straight into it with the definition of normal personality. So, your personality is the innate, enduring, and recognizable pattern of perceiving, relating to, and thinking about oneself, other people, and the environment. It is influenced by our genetics, development, and environment in which we grew up in. It is a continuum from a normal, flexible, adaptive personality to some prominent or maladaptive traits, from a slight impairment in general personality functioning to a full personality disorder. There are 4 domains that influence general personality functioning. They are generally separated into self-functioning domains and interpersonal functioning domains. The self-functioning domains include identity, which is your sense of self, self-esteem, emotional range, and your capacity for emotional regulation, as well as self-direction. Self-direction is your ability to pursue meaningful short-term life goals. They should be coherent and realistic. This also includes your internal standard of behavior, which is usually constructive and pro-social. And lastly, your ability for self-reflection. In interpersonal functioning, the first one is the empathy domain. Empathy refers to the comprehension and appreciation of other people's experiences and motivation, your tolerance of differing perspectives and ideas, and the understanding that our own behaviors have effect on others. Intimacy refers to the depth and duration of connections, our desire and capacity for closeness, and our ability to engage in reciprocal behavior. Now, defense mechanisms. Our defense mechanisms are the unconscious psychological mechanisms that decrease anxiety from unacceptable or potentially harmful stimuli. These are generally categorized into 5 separate groups, namely primitive, immature, neurotic, mature, and other. Getting into the etiology of personality disorders. It is quite multifactorial, so a number of factors contribute to the development of personality disorders, including that of genetic factors, neurobiological, childhood and developmental factors, important of note early childhood abuse, psychological factors, and lastly, social cultural factors. When it comes to the prevalence of personality disorders, it occurs in about 10 to 15% of the general population, and it contributes to up to 50% of psychiatric inpatients and up to 40% of psychiatric outpatients. So a rather prevalent disorder. Moving on to some more definitions that are quite important. Personality traits. So personality traits is the tendency to feel, perceive, behave, and think in relatively consistent ways across time and situations. Traits may be manifested in a way which can cause personal problems in social, occupational, and leisure functioning. There are 5 main trait domains. Number 1, negative affectivity. Number 2, detachment. Number 3, antagonism. Fourthly, disinhibition. And lastly, psychoticism. So a brief description of each. Negative affectivity usually includes your emotional lability, your anxiousness, separation, insecurity, submissiveness, and hostility. Detachment, in summary, is the limited capacity for happiness. This includes withdrawal, intimacy avoidance, anhedonia, depression, restricted affect, and suspiciousness. Antagonism refers to behaviors that put the person at odds with others, such as that of an exaggerated sense of self-importance, expectations of special treatment, carelessness, being unaware of other people's needs and feelings, and a readiness to use others in service of self-enhancement. These clinical features include manipulativeness, deceitfulness, grandiosity, attention-seeking behavior, and carelessness. Disinhibition is the orientation towards immediate gratification. Psychoticism refers to culturally incongruent or odd, eccentric, or unusual behaviors and cognition, as well as their content. Okay, so the diagnosis of a general personality disorder at our medical institute, we use the DSM-5. That includes a criterion from A to E, and all of these criterion must be met in order for a person to be diagnosed with a general personality disorder. So criterion A states that this should be an enduring pattern of inner experience and behavior that deviates markedly from expectations of a person's culture in two or more areas. These areas include cognition, affectivity, interpersonal functioning, and impulse control. Criterion B, the pattern must be inflexible and pervasive across a broad range of personal and social situations. Criterion C, there must be impairment of some sort, whether that be social, functional, or occupational. Criterion D, this pattern of behavior should be stable and of a long duration. And lastly, these clinical features should not be due to any other medical condition or substance use. So personality disorders are categorized into three main groups: cluster A, B, and C. Cluster A includes paranoid personality disorder, schizoid, as well as schizotypal personality disorder. The first on our list, the paranoid personality. These are patients that present with distrust and suspiciousness. Other people's motives are interpreted as being malevolent. They are hypervigilant, and they can report feelings of aggression, fear, shame, anxiety, or the feeling of never feeling safe. Their defense mechanisms usually include denial and projection. This diagnosis has a chronic course, but with a waxing and waning sort of pattern. This leads to persistent functional as well as social impairment. Next is the schizoid personality disorder. The patient is quite detached from social relationships with a restricted range of emotional expression. They can be easily overstimulated, which can explain why they would prefer to be isolated, and they can also come across as indifferent to what is happening to them or in their environment. Their defense mechanisms are usually that of withdrawal and intellectualization. This is a chronic course, and if there is persistent isolation, it leads to a poor social interactions and a decreased quality of life. Lastly, in this cluster is the schizotypal personality disorder. They express acute discomfort in close relationships. They have cognitive or perceptual distortions and eccentric behavior that can come across as bizarre or peculiar. They can have social anxiety, and there are usually blurred lines between what is fantasy and what is reality. This takes a chronic course, and patients who are diagnosed with schizotypal personality disorder are at an increased risk of developing schizophrenia and also at an increased risk of suicide. Next are our cluster B personality disorders. These include antisocial, borderline, histrionic, and narcissistic personality disorders. First on our list, antisocial. This is when the patient has a disregard for and a violation of other people's rights. They can present as aggressive, impulsive, manipulative, high-functioning and charming, and they can also have failed human attachments. Their defense mechanisms are mainly primitive. This diagnosis has a variable course, and it can improve in adulthood, but dependent on the individual. There is risk of legal as well as substance abuse, as well as suicide. Next is the borderline personality disorders. These patients usually exhibit instability in interpersonal relationships, instability in self-image, instability in their affect, with a marked impulsivity. There's a great fear of abandonment and fear of isolation. They could be quite manipulative and self-harming. Their defense mechanisms are usually primitive. This diagnosis also has a variable course with a possible stability with an increasing age, but individual dependent. There is a risk of suicide and also a risk of developing other mood disorders. Histrionic personality disorders. This is when the person has excessive emotionality and attention-seeking behavior. They are usually manipulative and often see themselves as being attractive and charming, which comes across as being seductive. Their defense mechanisms include exhibitionism. This is to secure favors and to secure the attention that they seek, and also sexualization as a defense mechanism. This diagnosis of histrionic personality disorder, these patients are usually more prone to dissociation and they have a risk of substance abuse. Lastly, in cluster B, we have narcissistic personality disorder. These patients usually have a sense of grandiosity, need for admiration, and lack of empathy. They can come across as arrogant, needing center of attention, and their self-esteem is usually maintained by affirmations, which also means that they handle criticism quite poorly. Their defense mechanisms mostly of that of idealization and devaluation. This is a chronic course and a very difficult to treat personality disorder. There's an increased risk of depression and substance abuse. And lastly, in cluster C, we have the avoidant personality disorder, dependent, and obsessive compulsive personality disorders. First on the list, avoidant. So these patients usually exhibit social inhibition. There's feelings of inadequacy and hypersensitivity to negative evaluation, which can clinically feature as depression and feelings of emptiness. Their defense mechanisms are usually that of fantasy as well as withdrawal. This is also a chronic course with risk of depression and risk of developing social phobias. Dependent personality disorder. These are usually the patients that are quite submissive and they have clingy behavior, which is both related to an excessive need to be taken care of. They also exhibit withdrawal from adult responsibilities. Their defense mechanisms include introjection and turning on oneself. This leads to occupational or functional impairment, and they are quite prone to being abused. Lastly, obsessive compulsive personality disorder. This is when the patient is preoccupied with orderliness, perfectionism, and control. Their behavior is usually rigid and rule-bound. This diagnosis has a variable course and prognosis, very dependent on the individual. There is a risk for anxiety or depressive disorders. Now, in the management of general personality disorder at the level of GP, it is important to recognize the different personality traits, recognize if a personality disorder is present, and while accommodating for the personality, we should focus on the presenting general medical problem and then refer to a clinical psychologist or psychiatrist. Once they are at the specialists, psychotherapy is usually the mainstay of treatment. This includes your psychodynamic and psychoanalytical, as well as your different brain therapies and group therapy. Pharmacotherapy is mostly for symptomatic relief. This is also prescribed by the specialist and not at a GP level. So, for example, if the patient presents with more bipolar disorder symptoms, you could prescribe a mood stabilizer and antipsychotic. If the patient is of the paranoid and schizotypal disorders, then antipsychotic would be of benefit. And if the patient belongs to the cluster C personality disorders, then an SSRI or other antidepressant might be beneficial. Okay, it seems that I have made it within the 15 minutes. Thank you very much. I hope this video helped and good luck for all your exams.